All right, welcome to The Explainer. Today, we are jumping headfirst into one of the most mind-bending technologies out there, brain-computer interfaces. We're going to unpack how these systems forge a direct link between the human mind and a machine, literally bypassing the body to restore lost abilities, enhance our own, and completely rewrite the rules of how we interact with the world. Okay, so here's our game plan. We're going to start with the absolute fundamentals, the building blocks of how BCIs even work. Then we'll dive into the most powerful medical uses, how they're restoring the body. From there, we'll face the single biggest hurdle in the whole field, the biological barrier. After that, we'll look at the flip side, augmenting human abilities. Then we have to tackle the really tricky stuff, the neuroethical frontier. And finally, we'll zoom out and look at the path forward, the hurdles, and what the future holds.
All right, first things first, we got to start with the fundamentals. Before we can get to the wild, futuristic stuff, we need to get a solid handle on the core concepts, the different types of BCIs, and the basic rules that govern how they all operate. This is the foundation for everything else we're going to talk about.
So, at its absolute core, what is a brain-computer interface? Well, you can think of it as a direct hotline from your brain's electrical chatter to an outside device, like a computer or a prosthetic limb. The really key phrase here is that it bypasses the normal pathways. So, normally, to move your hand, a signal goes from your brain, down your spine, through nerves, to your muscles. A BCI just skips all that. It creates a brand new way for your mind to interact directly with the world.
Now, to really understand this field, you have to get this one central idea. BCIs aren't just one thing. They exist on a spectrum. And that spectrum is defined by one core trade-off. And this is everything. The better the signal you want to get, the more invasive you have to be. To get that high-fidelity, crystal-clear signal from the neurons, you have to get closer to them. And getting closer means more surgery. It's a constant balancing act between signal quality and risk. This analogy just nails it. Think of your skull as a thick, concrete wall, and the conversations your neurons are having, they're just tiny whispers. A non-invasive EEG cap is like putting a microphone on the outside of that wall. You might hear something, but it's going to be faint, muffled, and all mixed together. An invasive implant, though, that's like drilling a hole and putting the microphone inside the room, right next to the people whispering. You hear everything with incredible clarity. That's the difference we're talking about.
So let's break that down with this table. At the top of the food chain, you've got your fully invasive implants, like microelectrode arrays. These go right into the brain tissue. The signal quality is the absolute best, the gold standard. It's what you need for super complex stuff, like controlling a robotic hand with individual fingers. But the risks are huge: brain surgery, infection, and, as we'll see, the signal degrades over time because of scarring. Take a step back and you have a semi-invasive ECOG. This sits on the surface of the brain, under the skull. Still a major surgery, but because it doesn't pierce the brain, it's more stable long-term. Then you've got these new, promising subscalp EEGs, trying to get close to ECOG quality with a much simpler procedure. And finally, at the other end, you've got your completely safe, non-invasive scalp EEG. The signal is noisy, but it's perfect for things like rehab or gaming.
So all of this points to this massive hunt for what you could call the minimally invasive sweet spot. The extremes are tough, right? Super invasive is too risky for most, and non-invasive is often too weak for the big clinical applications. So a huge amount of the research, the money, the innovation is pouring into this middle ground. Companies are desperately trying to develop something that gives a signal that is good enough for real medical use without the life-threatening risks of penetrating the brain. This is where the action is right now.
Now, beyond how we get the signal, there's also how the information flows. A unidirectional BCI is just a one-way street. Your brain sends commands out, you control something. The only feedback you get is by, say, watching your prosthetic arm move. But a bidirectional BCI, that's a two-way superhighway. It doesn't just read commands from the brain, it also writes information back to the brain. This changes everything. It's the difference between a remote control and a truly integrated body part. Let's walk through this, because this is where it gets really cool. Okay, so first, the BCI reads your intention to grab a cup from your motor cortex. Second, the prosthetic hand grabs it. Third, sensors in the fingertips of that hand are picking up data on pressure, texture, temperature, and here's the magic. Step 4, the BCI takes that sensor data, turns it into a pattern of electrical pulses, and zaps it directly into your sensory cortex. The result? Step 5, you feel the cup in your non-existent hand. This isn't just about better control, which it gives you, it's about embodiment. The device stops feeling like a tool and starts feeling like you.
And that idea points to the ultimate endgame. The final goal here isn't just about controlling a robot arm. It's about creating what some call a neural coprocessor. Think about it. This would be a device that doesn't just talk to things outside the body, but actually works inside the brain's own circuits. It could listen to a damaged part of the brain, process the signal, and then speak that corrected signal to another part of the brain. You could be bridging gaps from a stroke, or maybe even boosting normal functions like memory. This is that human-AI symbiosis that companies like Neuralink are really shooting for.
Okay, enough of the theory. Now let's talk about the impact this is having on real people, right now. In this section, we're focusing on the most life-changing medical uses for BCIs, where this tech is literally reconnecting people's minds to the world when their bodies have failed them.
For people with devastating conditions like locked-in syndrome or late-stage ALS, their mind is perfectly sharp, but they are prisoners in their own bodies. BCIs are a lifeline. The early systems were simple, using brain waves to move a cursor to type on a screen. Another really clever trick is the P300 speller. It flashes letters, and your brain gives off a specific electrical hiccup, the P300 wave, right after you see the one you want. The BCI just looks for that signal. But the real cutting edge, the holy grail, is decoding the signals for speech directly from the brain and turning them into a voice. And the progress on that front is just staggering. Get this. Recent trials are reporting up to 97% accuracy in translating brain signals into synthesized speech. And this is for people who haven't spoken a word in over a decade. But what's really fascinating is that this isn't just a BCI story. It's an AI story. The raw data coming from the brain is a chaotic mess. It's modern AI, these deep learning models that can actually make sense of it all and turn that neural noise into clear language. The BCI provides the data, the AI provides the magic.
Now this quote might seem a little technical, but I promise you it is huge. Most BCIs need a team of scientists to come in and recalibrate them all the time. It's a massive pain. This trial showed a system that worked stably for 3 months with no recalibration. Why does that matter? It's the difference between a cool science experiment stuck in a lab and a real-world medical device that someone can actually take home and use to talk to their family on their own. It's the key to independence. So when we talk about restoring movement, we're really talking about two different philosophies. An assistive BCI is there to replace a function permanently. You think forward and your BCI-controlled wheelchair moves forward. But a rehabilitative BCI is different. Its goal is to help the brain heal itself. A perfect example is pairing a BCI with something called FES, or functional electrical stimulation. The BCI detects your intention to move your paralyzed arm, and then the FES system sends a little jolt to your arm muscles, making them move. You're relinking intent to action. This forces the brain to start rewiring itself, based on that old principle. Neurons that fire together, wire together. You know, when we talk about restoring senses, there is one undisputed heavyweight champion, the cochlear implant. It's the most successful and widely used BCI on the planet, hands down. But its real importance goes way beyond hearing. It proved a vital principle for the whole field. See, the signal a cochlear implant sends is actually really crude and noisy compared to natural hearing, but it's good enough. And over time, the brain's amazing ability to adapt, its neuroplasticity, allows it to learn to interpret that weird artificial signal as meaningful sound. This was a revelation. It meant we don't need to perfectly copy biology to succeed.
And that good enough principle is being applied everywhere now. For vision, implants can stimulate the visual cortex to create flashes of light called phosphenes. It's not a clear picture, but users can learn to see shapes and navigate. For touch, this field called neurohaptics, we're putting sensors in prosthetics and feeding that data back to the brain so the user can feel. And the impact of touch is massive. It helps you control the limb better. It creates that feeling of embodiment. And amazingly, it can actually help relieve the agony of phantom limb pain.
All right, time for a quick pop quiz. What's the single most successful, most common sensory BCI out there? And what's the key lesson its success taught the entire field about the brain? If you're thinking of the cochlear implant, And the principle that the brain can learn to understand a good enough artificial signal, you've nailed it. That's the one.
So for all this incredible promise, especially with these implanted devices, they all slam into the same wall. And it's a big one. In this section, we're going to face the BCI's greatest enemy, the brain's own immune system. You could argue this is the single biggest thing holding back the long-term future of this tech.
So, what is it? What's the BCI's #1 enemy? It's not a bad algorithm. It's not a dead battery. It's something much more fundamental, much more stubborn. It's the brain itself. The problem has a name, the foreign body response. Your brain is a fortress, very carefully protected from the outside world. When you stick a piece of hardware in there, no matter how advanced, the brain's own private security force, these cells called microglia and astrocytes, freak out. They see the implant as a hostile invader, an uninvited guest, and they mount an attack.
And that attack leads to something called gliosis, which is basically scarring. Over time, those immune cells build up a thick, dense wall of scar tissue that completely wraps around the implant. For a BCI, this is a disaster. That scar tissue is an electrical insulator. It's like wrapping your microphone in a thick, wet towel. It muffles the signal, and it physically pushes the neurons further away. This is why many implants just stop working well after a year or two. The signal fades to nothing.
So this is the big fight, and researchers are coming at it from all sides. In materials, they're creating super soft, flexible materials that feel more like brain tissue that trick the immune system. They're changing the shape and size of the electrodes. They're adding special bioactive coatings that can ooze anti-inflammatory drugs. Some are taking that strategic retreat, focusing on less invasive tech that doesn't poke the brain directly. And a huge one, get rid of the wires. Developing fully wireless implants is key because those wires going through the skin are a constant highway for infection.
Okay, so we've talked a lot about fixing things that are broken. Let's shift gears. Now we're going to explore the other side of the coin, using BCIs to augment the abilities of healthy, able-bodied people. This is where we leave the hospital and head into the office, and even onto the battlefield.
So right now, the most realistic use of BCIs in the workplace isn't about controlling things with your mind. It's about passive monitoring. Think about miners or truck drivers wearing a special cap with EEG sensors. The system isn't reading their thoughts. It's just quietly watching in the background for the telltale brainwave patterns of drowsiness. If it detects that someone is about to nod off, it sounds an alarm. It's a safety tool, pure and simple.
Now for something that feels like it's straight out of science fiction, controlling a whole swarm of drones with your thoughts. The key here is that the person isn't trying to fly each drone individually. That's impossible. Instead, the person is the high-level commander. They just think of the big-picture command like, search that whole area, or form a defensive perimeter. The BCI headset picks up that messy, noisy signal. An AI then acts as a translator, turning that vague thought into a specific order for the swarm. Then, the swarm's own onboard AI takes over and figures out all the little details. The human is the general, the AI is the army.
But we have to ask, who's paying for this research? A lot of it is coming from defense agencies like DARPA. And this immediately throws us into a serious ethical problem, the dual-use dilemma. The exact same technology that could be used to coordinate a swarm of drones to find survivors after an earthquake could also be used to command a swarm of autonomous attack drones. It's the same tech, with two vastly different outcomes. So let's look at the companies actually building this stuff. It's a really interesting landscape. You have the high-risk, high-reward players like Neuralink, with a radical robot-implanted threads, and BlackRock, whose implants have been the workhorse of research for years. Then you have companies trying to be clever and less invasive, like Synchron, which sends its device through your blood vessels, or Precision Neuroscience, which is making a flexible film that just lies on the brain's surface. And then you have a totally different world of non-invasive companies, like Emotive, selling headsets for wellness and research, and OpenBCI, which is all about making the tech accessible to everyone.
Okay, another quick board-style question. Let's say you want to start a company making a BCI for video games. Looking at this chart, what kind of tech are you going to use, and why? Well, it's a no-brainer, right? You're going with non-invasive EEG. Why? Because you can't ask a gamer to go get brain surgery. For a consumer product, safety and accessibility are everything.
The risks and costs of anything invasive are just completely off the table.
All right, this brings us to what might be the most important and difficult part of this whole conversation, Section 5. We are now entering the neuroethical frontier. Because as this technology gets more powerful, it raises some absolutely profound questions about our society, our laws, and ourselves. So let's just start with the biggest, scariest question. Who owns your thoughts? When a device can read your brain activity, it's collecting neurodata. And that's not like your browser history. This data can reveal your emotions, your attention, your subconscious biases. The thought of that data being hacked, or sold to advertisers, or used for government surveillance, it's a threat to a level of privacy we've never had to defend before.
And then there's this idea of cognitive liberty, your right to control your own mind, to be free from mental manipulation. This becomes a massive issue with those bidirectional BCIs we talked about. If a device can write information to your brain, not just read it, it blurs the line between you and the machine. It calls into question your autonomy, your sense of self. Who's making the decision? You or the algorithm?
And what about fairness? Let's be real. When these cognitive enhancement BCIs arrive, they're going to be incredibly expensive. So what happens then? We risk creating a neuro divide, a new kind of class system not based on money, but on biology. You'll have the enhanced and the unenhanced. That's a kind of inequality that could be impossible to overcome, and it raises huge questions about justice.
So, what do we do? Well, ethicists and scientists are trying to get ahead of this by proposing some basic guardrails. Things like prioritizing research that helps people, not just enhances them, making sure consent is real and ongoing, creating special legal protections for brain data, thinking hard about that equity problem. And this last one is so important, creating a right to post-trial care. You can't put a device in someone's brain, have them become dependent on it, and then just take it away when the study ends.
All right, let's bring it all home. In our final section, we're going to look at the big picture. What are the major roadblocks holding this technology back, and what does the path to the future actually look like?
So what are the biggest showstoppers? Well, the number one problem, making up a huge 40% of the challenge for implanted devices, is that biological barrier, the scarring, the immune response. That's the big boss. Right behind that are the technical hurdles, getting a clean signal, powering the thing, making it last for years. Then you have all the socio-regulatory issues, the insane costs, getting people to trust it, and creating the laws to govern it. And finally, there's this really weird problem of user variability. For about 10 to 30% of people, the tech just doesn't work well. We call it BCI illiteracy, and we're still not totally sure why it happens.
So here's a plausible timeline. In the next 3 to 5 years, you're going to see a lot more of those non-invasive EEG caps for things like wellness and safety. In the midterm, say 5 to 15 years, we might see the very first fully implanted medical BCIs get regulatory approval, and touch feedback will become standard for high-end prosthetics. But the long term, 15 years out and beyond, that's where it gets wild. If, and this is the billion-dollar if, we can solve that biological barrier problem, that could unlock things like true vision restoration for the blind, and maybe even the first safe and effective cognitive enhancers.
And that leaves us with one final massive question. We're watching 3 huge fields, neuroscience, AI, and material science, all crashing together. And as they do, we have to ask ourselves, are we just on a path to repair the human body, to fix what's broken? Or are we actually on a path to fundamentally redefine the very meaning of what it is to be human? That is the ultimate question that this technology forces us to answer. Thanks for joining this explainer.